The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today I'm joined by a member of our U.S. Armed Services. He's in the Navy Reserves. John Rezendes is joining me. He's a testicular cancer survivor. He has a little something to say about that. So, John, I'll let you take it away right now real quick.
All right, Stephen. Yeah, so basically anything I say today about the United States military, DoD, are strictly my opinions. They do not reflect DoD policy, United States military, United States Navy. It's just my opinions, my standpoint.
Perfect. And you know what? Having been deployed to Bahrain like you were, I think, no matter what testicular cancer did to you, you got more balls than a lot of people. So shout out.
Appreciate it, Stephen.
So before we get into your testicular cancer story, tell me a little bit about who you are.
Yeah, so about to turn 29 in June. I have a wife, two kids, 9 and 7. Been in the Navy. I just hit 10 years in January. So I wasn't always reserves. I started out active duty. I was an aviation support equipment technician from 2014, 2018 on active duty. Served at Fleet Readiness Center, Mid-Atlantic, Norfolk, and then the USS George H.W. Bush. I then decided to transition to the Selective Reserves, where I changed my job to an operations specialist. And now I've been in the reserves since 2018 and went to Bahrain in 2022. I'm still loving it, still having fun. So stick around till it's not fun any longer.
We're basically neighbors. And if you were in Norfolk, I'm in Virginia Beach. So we were near each other. Didn't even know it.
Yeah. Yep. Yeah. Well, I'm in West Virginia now, but yeah, I was down there for 4 or 5 years. I lived right along Shore Drive.
Oh, wow. Okay. Yeah. I'm very familiar. All right. So let's talk about your testicular cancer. So tell me, when did you notice it? What was going on? Had you ever heard of testicular cancer before?
Yeah. So, where I actually work for the Navy as a civilian as well. A coworker of mine, was diagnosed with testicular cancer about a year before I started working there, so I kind of had questions for him. Now he was stage 1, orchiectomy, surveillance done. He was pure seminoma. So that's kind of how I was like, wow, okay, this stuff's really hitting people. And then in 2022, went to Bahrain. And then in June frame time, I started talking to the Navy docs over there. I was like, hey, I'm on active duty. I'm on TRICARE right now. Can I get a vasectomy over here? And they were like, yeah, actually, we have a doctor out in town. He does them for us all the time. Of course, they went through everything they needed to, make sure I was making the right decision. Wife and I are done. So went out in town, had a vasectomy. Everything's fine. And about a week or two after the vasectomy, I'm like, man, something is wrong. Something's going on with the left. It's not right. I couldn't figure it out. Of course, I'm Googling all kinds of stuff, thinking maybe it's, post-traumatic vasectomy pain disorder. And I'm like, oh, no. So I go to the doc on base and they're like, no, you got to give it a few more weeks. It'll go away. Okay. So a few more weeks went by, didn't go away. So then it took my follow-up with that Bahrain doc. And I'm like, hey, something's going on with the left. Don't know. So, takes a look. And as soon as he touched it, he was like, all right, you need to go get blood work. You need to get an ultrasound. So went and got the ultrasound. And honestly, they really couldn't tell what was wrong. They had no idea. Nothing was straightforward. Yes, there is malignancy in here. And then I got my blood work done. Blood work was normal. So I went back to the docs on the Navy base, and they were like, it doesn't look like you have cancer. I'm like, yeah, I guess not. They did a CT too. So, and everything was normal. Mm-hmm. So they were like, doesn't look like you have cancer. Well, about this time, I had 3 weeks left till I got back to the States. And, so basically they were like, hey, just wait to 3 weeks, get back to the States, figure it out then. And, for those who aren't familiar, when a reservist gets put on active duty and, mobilize is what we call it, you have to be fully medically fit to come back to the reserves. They can't just, something goes wrong while you're on orders. They're not just going to let you go, back home with being kind of messed up. So I got back to Portsmouth and Doc took one look and he was like, yeah, that's coming out tomorrow.
Mm, geez. So I'm sure you can't talk exactly like what you were doing in Bahrain, but I mean, were you doing anything physical? Like when you had your vasectomy, did you go back to work? And then what was that like?
No, actually, the Navy gave me so most of my stuff was office work, and the Navy gave me a week off, and I really listened. Like I laid on my couch for like 3 days. A bag of peas, and I got in shape over there. So I was dying to get back to the gym, but I did everything I was supposed to.
And was your wife over there with you, or was she still
No,
back here in
her
Norfolk?
and my two kids were actually here in West Virginia.
So what was that like having this, uncertainty and being so far away from your family?
It was pretty frustrating. I was definitely, because I kind of had pretty much all the symptoms that a testicular cancer patient would have. I had a lump, I had the pain, I had the swelling, I had the firmness. I actually got hydrocele in the left too, pretty bad. Like, I mean, it was, the doc who did my orchiectomy even said, like, this surgery took 2 hours because it took me that long to get that fluid out.
Mm.
So I was pretty mad. I was like, kind of going back and forth with my wife, like, and I apologized to her. I was like, man, I should not have gotten this vasectomy. Like something's wrong.
And
Unknowingly to me, it was cancer.
what's that communication like? I mean, are you able to text with her or call her or FaceTime
Yeah.
or?
So this deployment was a lot better than when I was on the ship. On the ship, it's mainly email, and they have pay phones, but you got to pay for them. So this was, I had my own space. I had Wi-Fi. I had my phone. I could pretty much, as long as I wasn't in a secure space with the Navy, I could, text or call, FaceTime, whatever I needed to.
Yeah. All right. So when you said she was back in West Virginia, so that when you came back to Portsmouth, was she back down here then and with your family, or they were still in West Virginia?
So the way it worked with at least the Navy does it, they, when you get back, you do a week transition in Germany. Kind of, it's like a warrior toughness kind of, because reservists are leaving their civilian job, going into a stressful environment, it's a way for them to relax. And I'll say, if you've never been to Germany, like that was an awesome, little breather before getting back. But yeah, so I got back to Portsmouth. She came down to visit for a weekend, and that was before my orchiectomy. And I'm, even after, she saw it, she's like, man, this is not right. Like something's really messed up here. So, and then she kind of went back down, and that was kind of actually pretty crazy. So once I went to the doc, he saw it, he felt it. We got my blood work back, and they weren't too bad. I want to say my AFP was like a 9. My, it's been a while since I looked at these numbers. The beta HCG, that was like it was like a 15. And then my LDH was high. It was like 617. But no, when they were like, hey, this is coming out tomorrow, I remember calling her and being like, I'm getting surgery tomorrow. Now, luckily, we had family friends who were stationed in Virginia Beach. So they kind of helped out with getting me to the hospital and stuff. But she drove the 4 hours down. And actually, I saw her like he had already administered the, anesthesia and sedative medicine. And I saw her like maybe 2 minutes before that kicked in.
Geez, yeah, you were probably hallucinating, like, what, this can't be real.
Yeah.
So tell me more about the orchiectomy. I know you said that it took 2 hours. Like, what was the recovery like after, I'm assuming the wound was still healing from the vasectomy. I have not had one, but I don't know how invasive that is. So having the double kind of thing going on, what was that like?
Oh man, it was nuts. It was, literally, it was frustrating, really, because it's like, man, how much trauma, like these are my boys, it's like how much trauma is, going to continue down there. So the recovery wasn't too bad. I mean, Navy gave me 2 weeks of convalescent leave to recover and heal. And actually, I went home for it. I asked them, like, can I just go home? Like, I have not been home in 10 months. Can I please just go home? And they're like, yes, spend your convalescent leave the way you want. So, I think the hardest part was getting up and off the couch or the toilet or whatever. But for the most part, It is what it is, really. I was okay with it.
Yeah. And you mentioned the two kids you have. What ages were they at the time? Did they know anything was going on?
They were 8 and 6. They just turned 8 and 6. We kind of just explained to them like, hey, daddy's got bad stuff in him that the doctors needed to get out. They have no idea. Like, I only have one testicle and I have a daughter and a son. And, eventually one day I'm going to have to explain to my son, what happened and how he needs to be aware too.
Yeah. All right. So then moving forward from the orchiectomy, what were your next steps?
So basically, then I had to go back down to Norfolk because instead of being in a demobilization unit to go back into the reserves, they placed me in a med hold unit. The med hold unit, I was with them for like a week or two, in processing, stuff like that. I was in a hotel down there. Excuse me. And the doc at Portsmouth, I was kind of talking with her, talking with the command, like, what are the next steps here? And and the CT, I did get a CT prior to the orchiectomy, and it showed 3 lymph nodes of concern. So I was like, "What's the next step?" She basically said that she's not, a specialist in testicular cancer. She's like, actually, if you were really, full-time active duty stationed here, I would send you to Walter Reed. And I was like, really? So Walter Reed National Military Hospital in Bethesda. I'm like, man, I live an hour from there. And then actually, coincidentally, the family friends from Virginia Beach, he was an anesthesiologist in the Navy. He worked with Dr. Chestnut, who is at Walter Reed as a testicular cancer specialist. So I was kind of like, well, all right, that, I kind of want to go see him.
Mm-hmm.
So I talked to MedHold and, I told them the situation and they were like, wow, okay, you actually live near like the cancer foundation for the military, like go home, basically, go home, go to your appointments there, take care of what you need there. We got you on the back end, whatever you need kind of thing. So it was like, cool. So basically I became a remote patient.
Yeah. So then I know you had the RPLND. Did you have chemo at all?
I did not know. So the numbers were low enough. So the numbers kind of, they stayed put for, I think, 2 lab tests. And then all of a sudden they dropped and they normalized completely. And I'm like, oh my God, is this it? Like, do I not need to do anything else? And of course, the docs and the care team were like, no, we're still going to go with the RPLND. Because at first it was a toss up, like, are we going to do chemo? Are we going to do RPLND? Because they staged me at 2A. And then, basically when those numbers dropped, they were like, all right, RPLND, I think is going to be our best case.
So how long were you like on surveillance, I guess, between the orchiectomy and when the RPLND happened?
Orchiectomy was October of 22 and the RPLND was February of 23.
All right. So that was quick.
I got Christmas and, time with the family and yeah, so.
And I know that you mentioned to me that Dr. Sean Kern, who is a recently added board member of TCAF, did your RPLND. Can you talk about your experience with him?
Yeah, so it was awesome. I mean, literally, I was super scared, and my care team took really good care of me, gave me some contact information on other patients and stuff that had RPLND. Some good, some not good, some post chemo, and another one of your guests, Manny. Him and I talked. So I was pretty nervous, and I remember actually when they were giving me the Exparol, the nerve blocker, before it, Dr. Kern walked in and we were kind of talking, and he's like, "How you feeling?" I'm like, "Man, I'm nervous. Like, how bad is this recovery going to be?" He goes, "Well, the guy I did a couple of days ago walked out the next day." It's like, "Really?" It's like, "All right, let's do it." So I woke up and I remember I pretty much immediately told the nurses I want to walk. And they were like, no, absolutely not. No. I was like, all right, well, about an hour. And they were like, okay, fine. You can walk in an hour. And they didn't come back in an hour. My wife was with me and I was like, go get the nurses. I want to walk. And they were like, okay. So they came in and I walked like 1 lap around the room and I was like, all right, I'm done, laid back down and, and then like an hour later, I'm like, I want to walk again. And then I kind of walked down the hallway and back. So, walking, they kept telling me the sooner you walk, the better. And they were right. So
Yeah, I can't even imagine walking that soon after. I was like vomiting into into the little like bag they gave me. Like that was tough. So hey, shout out to you.
yeah,
So February was that 23 then or 22?
23.
So you were like right before Dr. Kern was diagnosed himself.
Yeah. So us as patients didn't really know what was going on. Uh, Basically, he did my surgery, and then I remember having a follow up like a month or two later, something like that, a month or two. And they were like, yeah, Dr. Kern's out. Dr. Chestnut, has taken on, a bunch of patients and stuff. It's like, okay, no problem. Hope he's okay. And then it wasn't until it started becoming public knowledge between the Cancer Foundation and stuff that I found out. And it was like, whoa, it's pretty crazy.
Yeah, I mean, have you talked to him at all since then?
No, I have not had an appointment with him yet. He's been in the office as I've been in there, but I have not gotten the chance. They're pretty busy there with, a lot of patients and stuff like that recently.
Yeah. So who does your I guess are you on a 5-year surveillance plan now, even after the RPLND?
Yeah, yeah. So actually, 2 days from now, I have my year scan.
So is that all at Walter Reed, or do you go somewhere local in West Virginia?
No, so I usually go to Walter Reed for most of my stuff. If the military medical centers, if they're like, hey, we're too far booked out for something, I can go to Fort Belvoir or Fort Detrick or something like that. But I usually, as long as it's a military medical center, that's my kind of. But as for surveillance and seeing the doc, it's either Dr. Chestnut or Dr. Kern.
Yeah. Talk about like your experience with other guys in the Navy who you work with. I know you can't hypothesize on like the causes, but I know there's, there are exposures and things. I know you probably can't talk about that, but what is like what do you guys say about what you went through and then the other guy that you knew that had the 1A or stage 1? Like, what is that all like?
Most of us are worried about our career, honestly. I think most of us are pretty, gung ho about the military, and like I said, we're still having fun. So, a lot of the guys I talk to are like, "How can I get back to my unit, or how can I get back to my division or ship, or whatever?" But most of us, I mean, I trust a lot of the docs at Walter Reed. I mean, the knowledge that they have and stuff like that. And I kind of, whenever I get someone new that I'm talking to that recently diagnosed, I try to, tell them like, dude, you're probably in one of the best spots, in the United States, other than University of Indiana or MSK.
Mm-hmm. And then, sorry, let's go back to the RPLND. So the recovery for that, I know you walked like immediately. How long were you out before you were back to work?
So I was out, man, probably like a month and a half before I could do anything. So I'll say that I know we've talked about it before a little bit, but like the scar I had was super small. Dr. Kern is definitely a specialist in that. Anytime Chestnut, does my surveillance, he looks at it and you just can't believe how small it is and how he was able to get 36 lymph nodes out of just the left side from that. But the only issue I had with RPLND is I have nerve pain in my left leg. Don't know if a lot of people get that. Physical therapy's helped a lot. From what I've been told is the psoas muscles kind of pissed off and might still be pissed off from that surgery. But hey, if that's the least I got from all this, I'll take it.
Yeah, I know I had some left leg pain and some numbness, but mine subsided now. So maybe yours will in time. I'm not sure.
I hope so, because I still got it.
So you mentioned the like being medically cleared to go back. I know you're in the reserve. So what does it look like moving forward if you were to get was it mobilized was the word you use? Like if you were to get mobilized again, what does it look like given your history?
So basically, I cannot be mobilized for like 5 years after this.
Wow.
Yeah. So I have got to go through the entire surveillance cycle before I can even be looked at. I'm going to be basically put on a list, a medical list and it shouldn't hinder my career. Thank goodness I just did a deployment. So Actually, as a reservist, every day you're deployed is 5 days that is a dwell. So I'm in that dwell anyway. I just happen to be on another list that says for medical reasons now.
What does the dwell thing mean?
So basically, it's as long as you don't volunteer, they will not volunteer you to go.
Okay.
So I was there for 10 months, so for 50 months, they will not volunteer me to go.
Wow. Okay. So in survivorship, like, what has that been like for you? I know you mentioned like your son, you're going to have to eventually tell him, like, are you sharing with your, your network of your story? And obviously you're on this podcast, like spreading awareness. So what does that kind of look like for you?
Yeah. So, I mean, I'm pretty open about it. I've been, whoever wants to know, I haven't really like posted anything on social media. Of course, my wife says she's going to blow this up. So, but whoever asks how I'm doing, or especially male friends and stuff like that, or with kids, I kind of been telling them my story, and it's trying to get that early detection. But yeah, I mean, it's been going pretty good though. I mean, I like I said, I plan to tell my son when he gets a little older, kind of, because now he's definitely gonna have to watch my brother. It's like, hey, dude, I don't, not sure where I got this, but if it runs in the family now, you need to, check your boys.
Yeah. Shout out. Is there anything else that you want to add that I didn't ask about?
No, I don't think so. Just yeah, I mean, military service members, even if you guys are, overseas or, West Coast, I know TRICARE can be kind of funny over there, but man, just check your stuff, get to a doc, and worst case scenario, I know Walter Reed's trying to get some kind of system going to some kind of advice line for testicular cancer because it's becoming so common. Yeah, I mean, if you have any questions, definitely Walter Reed's the number to call.
Can you talk as much as you can about the insurance thing, like being in the military? Like, are you stuck with the military hospitals, or can you go anywhere else to a specialist?
No, so when you're active duty, you have to stick with TRICARE. I know, and it's not necessarily TRICARE is the problem over on the West Coast. It's not. It's the civilian companies over on the West Coast don't want to accept TRICARE, unfortunately. Like think of big ones like a sperm banking, whatever building, department. They're kind of, because it's so expensive. But yeah, it's mainly because of civilian.
Yeah, and I guess maybe this is more of a question for Manny, but I think he went to IU. Do you know that? I can't remember.
For college?
For his surgery.
Oh, yes. No, not as RPLND.
Okay. So I was going to ask how did he get over there? So yeah, I guess.
Yeah. Yeah. So that's, and that's a good question. I mean, TRICARE will accept, civilian will accept TRICARE on certain circumstances for active duty members. That I have no idea how it happens. But like, for example, right now, my wife and kids are on a plan that they can go see civilian, but I can't because I'm active at the moment.
Interesting. Okay. Maybe I'll try to get Dr. Kern on here and talk about military specifics and how he's trying to like create that program, the Testis program.
Yeah. Yeah. Cause I don't know what's going on, but it's definitely becoming more common.
Yeah. Cool. Well, where can people find you if they want to learn more? I know you said you're not big on social media, but.
Yeah. I mean, I am on social media. I'm, Instagram, Facebook. Let's see, I can do. But my name on most social medias, I go by JJ John Jr. Instagram. Let's see here. I always forget what my thing is. It's JJ _Rezendes _.
Sweet. John Rezendes, thank you so much for your service. Thank you for being on the podcast, and thank you for that awesome mustache.
Thanks, Stephen.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.